Hello everyone, and welcome to another Arthritis Help Movement Improvement session where you learn to move differently so you can feel better. I'm Dr. David Sofer, physical therapist, and today we're going to be talking about quieting down those creaky or noisy knees, improving pain with knee arthritis, especially by training a new way to walk or noticing how you walk and seeing if we can walk a little bit differently. I'm going to do a little anatomy lesson here. This is your knee, okay? This is a side view. This is the outside of your knee. And you can see that we have this thigh bone on top and the shin bone or the tibia on the bottom. And in between, we have a ligament that holds it together and then the cartilage. You can see it a lot better from the back. This kind of fat lip right here, this is the back of the knee, is the cartilage. And now you can sense that if weight is going up and down, pushing downward, it's going to compress that cartilage, and the body has a great opportunity to withstand that force. Cartilage is great at taking compressive forces. Bones are great at taking compressive forces. If you can maintain force like that, even if you have an arthritic knee, the knee will feel pretty good. Now, sometimes imagine that when we bend the knee, my model doesn't bend so well, but imagine that we bend this knee and then force goes forward so that this knee starts to push this way. You can see how it would create a shearing force forward and back of the thigh bone of the femur on the tibia, on the shin bone below. And that shearing force back and forth is going to actually wear away and damage the cartilage, the meniscus underneath. So when we have more shearing forces through the knee with the way we move, it's going to increase breakdown and create more pain with your knee. So today we're going to work all on weight shifting our body and thinking about how we walk, and can we walk in a way that creates less of that shearing force and more of that up and down compressive force. So let's give it a try. Let's talk about the act of walking. It is, of course, a very basic activity that we've been doing our entire lives, but it is in its essence a hugely complex coordination of movements and activities to maintain balance, create mobility, and allow for propulsion through the body. So I want to just take a moment to break it down into a small piece and just get a sense of what walking is, and we're going to use that for a context of how we learn how to move and retrain walking. So today what we're going to talk about is the ability to transfer weight from the back foot to the front foot. So walking is at its core a series of weight transfers from back foot to front foot, and then placing the foot and going from back foot to front foot again. And just doing this repeatedly is the act of walking. And the transition from back foot to front foot is where a lot of people get hung up, and actually where a lot of irritation and damage can come into the knee or hip joint as a result of the way we move or translate from back to forward. So what I want you to do just for this first exercise is just place your feet 1 foot forward, 1 foot back in a comfortable split stance position. And we're just gonna shift the body weight forward and shift the body weight backwards. Don't think, just do it however comes naturally to you, your first inclination of movement through the body. And for most of us, what the first inclination is to bend the knee over the toe and keep the chest and torso upright. Okay? As we bend forward, we bend the knee and we keep the chest and torso upright. And that allows us to take the weight off of the back foot and onto the front foot. So much so that I can, take the foot off the ground without having any issue, without having to change. That's how I know I'm fully on my front foot. Now that act of bending the knee forward, while it's possible, can actually put a lot of stress and strain through the structures of the knee, like we talked about earlier. It creates a forward torsion, or actually translational force, a shearing force from the thigh bone onto the shin bone, and it helps to wear away that cartilage. So we have to figure out another way to move from back foot to front foot without creating that shearing through the knee. And if when you do this you have a creaky knee or a noisy knee or a painful knee, you're going to find that if you make this modification, it may make a change in what you feel. So now, instead of going from back foot to front foot by allowing the knee to translate over the toe, what I want you to do is I want you to stop your knee before it gets over your toe, before it gets over, if you were wearing shoes, the laces of the shoes. So we go from back foot to front foot, and then instead of lunging forward, I'm just going to stop the knee, kind of build a wall in front of the knee. And we're going to see, now I still have a lot of weight on my back foot. how can I get my weight off of my back foot onto my front foot without shifting that knee forward? And this is a little puzzle. It's a movement puzzle that we have to try to figure out. So let's see what we can do. If we continue to move forward, right, we're going to move through that knee. So we want to hold the knee, and the only way to do it is actually to keep that knee in place and then move the body up and over the back knee, and that has a little bit of forward pitch. Okay, and then we're going to come back. And so let's try that again. We're going to shift weight from the back foot to the front foot. We're going to stop the knee in space. Don't let that knee, we've got to restrain that knee. Don't let it come forward. So the knee is lined up over the ankle and the shin is perpendicular to the floor, straight up and down. And then we want to figure out how can we get the body up and over that foot, the front foot, without letting that knee lunge forward. And this can be, just this move right here, it can be very tricky for a lot of people because it requires a lot of coordination actually. You need to have freedom and mobility in the pelvis. If you're somebody who likes to arch and you come forward, you're going to have a very difficult time, or you're going to feel that you need to bow very far forward. You need to have that looseness and fluidity in the pelvis to allow yourself to stop the knee and bring yourself over. So just this in and of itself is an amazing exercise to help figuring out how to weight shift. Another tip that you need is this back foot. When you come forward, the back heel has to be able to rise up and the back knee has to be able to bend to come alongside the other knee in order to give you the freedom to move your pelvis. If your back knee stays straight, it's very difficult. It's going to lock you into an arch, and it's very difficult to find that way up and over the leg. So let's take a look at it one more time. Shifting weight from back foot to front foot, stopping the knee before it translates forward, and then moving my body from the knee up. The knee down doesn't move, from the knee up and over that leg, allowing the back knee to be loose and allowing the back foot to be free. The back foot, as you can see, I'm light on that back foot, so all my weight is on the front foot. And I've got this nice up and down. And here the weight is going up and down through the shin bone, so there's not that forward shearing force in the knee. So let's just practice that a few times. Shift from back, bend the knee, and come up and over, and then come back. You should feel that your weight is squarely on your front heel or back half of the foot. You don't want to feel the weight going up onto the toes or the heel popping up in that front foot. So we're just shifting weight forward with a little bit of lunge, a little bit of knee bend, and then come up and over, and then come back. Lunge, a little bit of knee bend, up and over, feeling all the weight down through the heel. You should feel the thigh muscles working and maybe even the butt muscles working on that front leg and feeling like you're light on the back leg. For people who struggle with this, they always maintain some weight on the back foot. So they come forward, but they never really get that back foot unweighted, right? So if they lifted that back foot, they would fall, or to lift the back foot, they have to make a big move with the body. You know that you're balanced over that if you don't have to move, and that back foot can be nice and loose. For people who don't like to take weight off that back foot in order to advance and take a next step, they almost have to jump or fall forward to take that next step, and that puts you at risk for falling and also creates a lot more of a jerky walk, a lot more impact with the walk, a lot more tension on the joints. Okay, I know you're thinking, I'm not going to walk stooped over. Don't worry, I got you. This is just a stepping stone to get us to where we want to be for the next exercise. So let's try that with the other leg, and it is remarkable how asymmetrical we can be with this activity sometimes. So again, just a nice split stance, right? Keep your weight on the back foot. First, just do that nice easy lunge. So you shift forward and shift backwards, shift forward and shift backwards. Feel your inclination. This is my first inclination. And feel how that knee translates forward, and feel that there's stress through the kneecap, through the front of the knee in order to kind of restrain yourself. We use tension of all the front of the knee tissues, and there's shearing forces between the bottom of the thigh bone and the top of the shin bone. So now we're going to shift the weight from the back foot to the front foot, but we're going to stop the knee and not let that knee translate forward over the laces or over the toes. And then we're going to figure out how can we get the body up and over that back foot without shifting weight onto the toes, without bending the knee forward, and then come back. And without keeping weight on that back foot. So let's try that again. We lunge forward, we stop the knee when it gets over the heel, or when that shin is up and down, perpendicular to the floor, and then we'll try to figure out, this is the puzzle, how do we get up and over that leg? And to do that, sometimes you need a little tuck of your tail. This little nuanced tuck is a nice trick. And feel that you can be soft on your back foot and balanced, and still up and down over that leg. If you're finding balance is a problem, that's fine. Just take a chair or a wall, something to help stabilize you. Don't use it for support, but just use it for a little bit of stability. So if I keep the hand on the wall and I shift forward, just a little something to help me balance, right? If you have trouble with balance, keeping balance and learning how to move at the same time can be very tricky. So take the balance component out of it. Let's try one more time. Shift the weight from back to front with a little lunge of the knee. Let that knee stop when it gets over the heel. Allow the back knee to bend and the right heel and the back heel to come up, and feel your body go up and over that leg and balanced through your left heel. And maybe even a little bit of a tail tuck can help you get off of the ball of the foot and balanced on the back half of the foot. For me, it comes really naturally on my right leg. My left leg, I need a little bit of thought, a little bit of maneuvering. It's not so intuitive for me, but I should practice. So we come forward, feel the weight on the heel, feel the body come up and over, feel that back knee bend, unweighting that back foot, and so all the weight's on the front foot, and that you feel solid up and down through the shin. So the weight is going up and down through the knee instead of forward through the knee. It's going to preserve the knee joint, and it's going to help you translate through space. Beautiful. Okay, so now we're going to take this and I'm going to show you the next progression from this to help you more closely mimic walking and help you get out of that shearing knee force when we're going through a walking activity. For the next progression of this walking weight shifting exercise, we want to be standing in front of a wall. And we're going to use the wall to be a cue for us to determine when our body is moving forward over our center of gravity or when it's moving upward over our center of gravity. We want the body to move forward until we get over that heel and ankle, and then from that point we want to be striving upward. And we want to stop that forward momentum and strive upwards so that we have this nice alignment through our body. The weight is going up and down through the bones and not shearing forward and back like we talked about earlier. So the way we do this is we're going to stand in front of the wall and you're going to take your toes and you're just going to put them either against the wall or you can put them back about a ½ inch, but you don't want to be back any more than that because you lose the effect that the wall gives you. So you want the foot at the wall or maybe a ½ inch away. And then we're going to keep the weight on the back foot like we've had, and we're going to this time keep the knee relatively straight. We're not going to lunge in like we did before. We're going to keep the front knee straight, and we're going to shift our weight from the back foot onto the front foot and just see what you do. Okay? And it's very easy now to try to want to keep more weight on the back foot because the wall here isn't letting us bring weight forward, so you're going to feel like you want to shift more weight on the back foot. So you want to see how do we get off of that back foot and onto the front foot. If you feel like you're losing your balance, you can put gentle hands on the wall, but you don't want to be leaning into the wall with the hands. That kind of defeats the purpose of the exercise. So we're going from back foot to front foot, and we just see, can we get off of that back foot? And when we do, what does our body do? Okay, the more the body is moving forward in space, either from the knee or from the belly, right, the more we're getting forward translation beyond the ankle, where we want to be lined up and down over the ankle. So what we want to think about doing now as we move intentionally, right, we've noticed our inclination and now we're going to move more intentionally. We're going to get the weight off of the back foot onto the front foot and see, as we get over the knee, over the ankle, can we just restrain the body from moving forward either at the belly or at the knee and still be so lined up over that leg that the back foot can be soft and easy, that it can even lift without having to make too many adjustments. Okay, so we're going to find that again. We're going to shift from back foot to front foot, and you have to let the back knee bend while you keep the front knee strong. That can be challenging sometimes. As we shift forward, the front knee is strong, the back knee bends, we lift the heel, we roll over the toe, Both knees kind of come parallel to each other, and our body is up and down with room to spare in front of this wall. Okay, and you don't want to find yourself leaning into the hands, that you can actually see. Perhaps you can see your toes, depending on how much body you have in front of you. Can you draw that belly back or the hips back and see your toes down in front of you? If you have a tendency to arch and stick that tail out, it's going to throw you forward into the wall. So we need to find that little bit of tail tuck to find your up and down over the heel and over the ankle. So I'm going to try that one more time. The weight's on the back foot. And we're going to shift the weight forward. The body comes forward in space until it aligns over the ankle and the heel. And then from that point, we want to find upward, not forward, but upward. How can we align the body moving up rather than moving forward? And then weight back on the back foot. And we're going to come forward again, off of the back toes, onto the front. And this, you very well might find that you have this inclination to want to stay on your back foot. If that's the case, that means you have trouble moving upward over the base. So that knee bends, a soft back foot, and that you're lined up maybe with a little bit of tail tuck over the leg. If you find that your pelvis is moving into the wall or your belly is moving into the wall, just try to draw them back a little bit without falling on your back foot and see, can you maintain balance over that front leg without having to move your whole body back onto the back foot. Feel long and strong and tall over that front foot. If you can do this perfectly, good for you, you're in the minority. If you're struggling with this, that's great. That's just your opportunity to improve. This is what you can change to make walking more comfortable, easier, and less strenuous through the knee. Shifting weight from back foot to front foot, coming off of that back heel, allowing that back knee to be soft, feeling strong through that front knee, and lining your body up, head, shoulders, hips, knee, over the ankle. The head might even be forward a little bit. You might even be a little bit kind of wanting to put your forehead toward the wall. That's fine. It's okay to move forward from the top. We don't want to move forward from the middle or from the bottom. And back off. All right, and you can see that if you spend time on that front leg, it can be strenuous, it can be tiring. So take as much rest as you need, don't work through pain. I'm gonna switch legs and we're gonna try the same thing on the other foot. So again, we're gonna bring the toes not to the wall is fine, or we can back off a 1/4 inch or a 1/2 inch to make it a little bit simpler. We're gonna feel that we start with the weight on the back foot. We're going to shift weight onto the front foot and just see what the natural inclination is. Let's just rock forward and rock back and do a little diagnostic and just get a sense of how we move or how our body's first inclination is to move. And for a lot of us, that's kind of belly forward. For some people, it's knee forward. Okay? And just get that sense. Now, what we're going to think about is as we come from back foot to front foot, can we stop our body at the line of the ankle and the heel? So as we come forward, can we come forward and then stop the body from moving forward past the heel and past the ankle and drive the body upward and let the back knee bend in line with the other and be up and tall. And for me, my right side does this way nicer than my left side. And so this is my preferred side. It's nice to have a little difference between the two. My left can learn from my right. I'm going to shift off of the back foot onto the front foot. As I move forward, the weight has to come off the back heel. The back knee must bend. It must be soft, and the body lines up over the front ankle, front heel. If you find that inclination to be forward with the pelvis or forward with the belly, that's okay. Try to draw back and feel, can you bring your center of gravity back over your foot, your heel, and your ankle without moving weight back onto the back foot or leaning into the wall. That soft back knee is important. If I were to keep this knee grounded or keep the knee straight, when I come forward, my only opportunity is to do this. It's very hard. I lose that flexibility and mobility in the pelvis. I can't tuck my pelvis with a straight back knee. So I need that back knee to soften so I can almost curl that pelvis up and under so I can line my body up over that heel as I come forward. Shift the weight to the back foot. And as I shift my weight to the front foot, I'm really being thoughtful about how am I balancing my weight over my front leg. I have so many options. How am I managing to do it? So as I come to that front foot, I want to bring my body over, and then as that heel pops up, the knee bends, The pelvis tucks under just a little bit, lines me up over the heel, and now I have this nice distance between my body, my belly, my chest, and the wall, and I'm balanced. My back foot can come up. If I wanted to, I have no weight on that back foot, and I feel the pressure through that back heel. Okay, this is a really nice, it's not simple, it's a complex exercise, but it's simple in its design in order to get you to feel how the body moves forward versus upward. If we can minimize forward past the ankle and find upward, we reduce all those shearing forces in the knee, and you feel a lot more comfortable. You'll have a lot more stamina and a lot less pain and strain as you're walking throughout the day. Thank you so much for joining me this week. I hope you realized how making some subtle changes in the way you move can change the forces, the dynamics of how you use your body. It can reduce this forward and backward strain or shearing force in the knee and create more up-down force, which the body tolerates much more easily. If you can get this little movement a little bit better, you'll find that walking is easier and moving is easier, and you're just going to find so much more comfort. Okay? Thank you so much for joining me this week, and thank yourselves for taking the time for doing something good for you. It's not easy, it requires commitment, and you should recognize that within yourself. Remember, you can find all of my videos on my website, www.arthritishelp.info. Join me next week where I'll bring you a whole new video showing you how you can move a little bit differently so you can feel better. Take care, everyone.